Everyone, I'm Melody, a USRN, and this is how I passed my Nclex on my first try in 145 questions. First off, I divided my study section into content and the question bank. So the content, I used Simple Nothing, Saunders, and Mackay lectures. So I listened to Mackay lectures. Mackay has lecture notes 1 to 12. It's actually an audio. You can find it anywhere on Spotify, on Apple Music, or on any other music streaming app that you might have. But I didn't have the time to listen to the audio, so I read the lectures. It has like a PDF of the lecture notes, so that's what I read. So the question bank that I used two question banks actually. I used the World and I also used Nclex question bank. So I drafted out a timetable of everything that I needed to know for the Nclex exam, of all the topics, all the courses that I knew that I had to cover: pharmacology, med surg, maternal and child health, pediatrics, basically everything that I needed to cover. I drafted it out. So I asked ChatGPT to help me create a timetable for the NCLEX study. So ChatGPT helped me break it down, and I told ChatGPT the amount of time that I had to study for this exam, and it helped me allocate all the topics to days, and I followed the plan strictly. That's what helped me stay on track for the NCLEX. So for the NCLEX, you don't just read for reading sake. You need to read and understand, because the kind of questions that you ask are critical thinking questions. So I wrote down some affirmations that I will be saying every day, because the NCLEX preparation is a process that can drain you mentally. So you have to be mentally prepared. Yeah. Then also I prayed as much as I read. If you're a religious person, I'll advise that you should pray, because it's really not by your strength, to be very honest. I also watched some videos on YouTube. I will be tagging them here. I watched a nurse called Dr. Sharon. She was very good. For every topic that I did not understand, I would always go to her videos and I'll watch the video over and over and over again. And she always has questions after every video that you watch, which made it so much easier and understandable. I also watched The Beautiful Nurse. She has a summary of everything that you need to know before you write the NCLEX or before you enter the exam hall. And I watched it before I think 2 days before I wrote my exam. I also watched it like 2 weeks before I wrote my exam, 2 weeks and then 2 days. I also joined the class on Telegram that helped me so much. I joined the class 1 month to my exam, and this class really helped me because there were other people on that in that class that were also preparing for the NCLEX, and my tutor was really really good. Before you write the NCLEX, go and do your research on the NCLEX. So the NCLEX is a 60 question, so they can ask you from 75 to 150 questions. Your computer can shut off at any time. Mine shut off at 145 questions. Some of my friends, their questions shut off at 85 questions, or mine shut off at 145 questions. So how the NCLEX test is that is to keep on asking you questions until it thinks that you have answered enough and you have either passed or you have failed. So it's either you have passed or failed. There's nothing like in between, or there's nothing like it's not like school where there's like an A or a B or a C or a no. It's either pass or fail. There's no mark allocated to it. Even when your result comes out, you will see that there's no mark allocated to it. It's either a pass or a fail. I believe we have come to the end of this video. So I hope you guys study for the NCLEX, use good resources, and I hope you pass in one sitting. Thank you and have a nice day. Bye.